Namaskar, hello and welcome to the IndiGlobal Cancer Care Symposium, Conquering the Art of Conquering Cancer. We are in the second panel discussion of the day. This symposium will continue for the second day as well tomorrow with experts and policy makers from across the country. We had an amazing inaugural session that focused on affordable and accessible cancer care and policies and collaboration for cancer care and cancer management. While we continue with this session, which would be focusing on the role of technology in cancer diagnosis and treatment and taking it to the next level. There are technology advancements that are happening, which is increasing the life longevity at the same time, helping us for early detection. In this particular session, we will look at how the technology is transforming and revolutionizing this cancer diagnosis, including the machine learning algorithms, artificial intelligence, and many others. We will have experts who would be talking on the technology that is in use and how they are helping the monitoring and treatment of cancer. So please join me in welcoming the first speaker of this session, who is a seasoned professional in the hospital industry, comes with an immense rich experience especially in the cancer care and cancer treatment. With over 16 plus years of experience in the hospital and operations, our speaker, who is Mr. Varun Sharma, Assistant Vice President for Strategy and Growth with American Oncology Institute. Welcome back, Mr. Varun. Thanks for joining us.
Thank you, Sudheer. Thank you, thanks a lot.
We are also joined by yet another speaker who is a senior consultant surgical oncologist, comes with over more than 1.5 decades of experience with surgical interventions, a lot of experience in treating the cancer patients, performing surgeries, and at the same time monitoring their care. Join me in welcoming Dr. Prabhat Raina, Senior Consultant Surgical Oncologist, RJSP Cancer Hospital. Thank you very much for joining us, Dr. Prabhat. I would also like to call upon Dr. MD Aftab Ansari, Senior Consultant Radiation Oncology and HCG, who's associated with HCG Cancer Hospital. Welcome, Dr. Aftab. Thanks for joining us.
Thank you. Thank you very much.
Yeah. So we shall go ahead with our first speaker, Dr. Prabhat Raina. Prabhatji, more than over close to 2 decades, you have been treating the cancer patients, and over the years, you might have also seen the latest technologies that are advancing, and you might be using them on treating the patients. Would you like to tell us the kind of impact it has made in transforming the diagnosis and also their use in surgical intervention, and how is it making a difference compared to the traditional way of treatment and diagnosis of cancer?
Thank you, Sudheer. First of all, before starting the diagnosis, I want to start about the technology part. For the last several decades, there is a technology, there is evolution in the information technology. So data collection and the data and amount of information we have in the digital form is enormous. So with the last 2 decades, the transformation of information from one place to other is massive. So you can transport the correct information, correct diagnosis, correct message you want to give to the public and to the society. It can be given in a huge way. You can cover a lot of area by this same program. By doing another similar program, or you can cover a lot of area. So cancer awareness can have it is increased. Still, there is a lot of work to be done, but because of the information technology transformation over several decades, this information has reached to the even the remotest place of the places of the villages and country. Because of this, people are aware there is a cancer, but still the information has not gone so much that there is still a treatable disease. There you can have a treatment, you can have a normal life, you can be treated, you can save your organ, your people, or your life. The purpose of this information technology is to provide the message to the remotest places of the country and villages, so that this information must reach to each and every individual household, family, and society that cancer is like any other disease. It requires your attention. Consult your doctor, understand the disease, understand the limitation, what is happening in the body, what is the treatment, what are the options, and you can have the treatment. The first most part I think the technology has given in this part. Another is about data. Because of the cancer happening in the different part of the country, different cancer is more prevalent. Like in the north area, we have oral cancer is very much common. Gallbladder cancer is very common. In southern India, thyroid cancer is common. So using this data, you can plan your society, can government can, or anybody can plan their screening program accordingly, so that they are more specific and the output will be much more significant. So the information technology, data interpretation, and according planning of the governments and any NGOs, any working committee which want to plan to the cancer treatment or cancer awareness, they can plan accordingly. Coming part to the diagnosis part, see, diagnosis is about doing some procedure, taking tissue and confirming it, or doing some investigation like blood test and CT scan, MRI. Over several decades, this has reached to the remotest place. Earlier, CT scan or PET scan was not available in the remote city, but it is available in tier 3, tier 4 cities also. This is the technology advancement which is percolated from metro cities to the smaller town and cities. But still a lot of work to be done on this part, that these tests, these investigation, these modalities are available in a small, almost all major towns. And the treatment aspect, since I am a surgeon, no, before coming to diagnosis part, one more thing is very common is doing about the genetic studies. A lot of work is going on in this part. Diagnosis, cancer is like something genetic change to happen in the cells, then it develops into cancer. So there are some changes which is still happening in our body before it is a full-blown cancer. So there is chances that we can detect these genetic changes, genes and mutations, and that can be diagnosed quite early, even before developing cancer. So a lot of work is going on this. We will see that in our life in near future, we can get some test available based on just not only blood, even saliva. You can analyze the cells and the genetic structure of that, chromosomal structure of that, and you can prognosticate or decide the chances of having cancer in future, or developing early cancer or late cancer. In the treatment aspect, I want to see that being a surgeon, I have seen that from the surgery which started from the incision, giving open surgeries, is converted to the laparoscopic surgery for last 1 or 2 decades. Almost all the surgery is going towards the laparoscopic way, that keyhole surgery or minimal invasive surgery we used to call. Now there is a similar way, the robotic surgery is coming in the cancer, in the advanced cancer surgery. This is helping a lot. There, in the body there are many more areas, there are gray area where just we can't see by just direct under vision in the naked eye. So these robots, these camera, these surgeries, they help it to visualize the different area of the cells in the pelvis, in the undersurface of diaphragm, in the thorax, to see the different area where you can do proper surgery. And this is helping the surgeons, even the patients, to do oncological complete surgery, reducing the pain, reducing the morbidity of the surgery, reducing the side effect of surgery. Still, we know this is one of the costly affair for to have an each and every routine surgery. But going to be next 10 decades, it is going to happen in much bigger way. Though robotic surgery is not like a surgery like robot is doing surgery, it's just helping a surgeon to do much better surgery by seeing a 3D visualization and a precise millimeter have a, some millimeter have precise cut or dissection so that we can have a better result in term of surgical output. Coming about the cancer treatment, technological by it has been growing for over several decades. And we are very much hopeful that technology will be going to govern us to have a better output in cancer treatment, starting from the diagnosis to treatment and then proper outcome. Over to, yes, Gautam.
Thank you, Dr. Prabhat, for taking us through the entire use of technology. And I can see that you are quite hopeful the kind of transformation that is going to happen in the coming years. Uh, Thanks for sharing that. Varun, coming back to you, uh, you have been in the operations over several years. Like, what is that you see in terms of this, the new terminology and the technology that we get to know every now and then? What is the use of this machine learning and again this artificial intelligence that's coming into play and much talked about before a patient comes to know about it in the later stage, uh, the diagnosis or identifying the disease in much earlier stage, and at the same time it comes with the technology comes with a cost or it's affordable, and what can government do and in terms of integrating those technologies, as
Yeah,
the government has a
thank you.
larger role to play.
Yeah, thanks, Sudheer. It's quite a big question to reply, but let me first thank Dr. Prabhat because what he has spoken about, the technology and the newer technologies which will be mainstreamed in next 5 to 7 years, which will basically give a lot of, hope to people and will be able to treat or reduce the disease burden. So that is going to happen because as he's spoken, about today's surgeries are no more open surgeries. The largely laparoscopic surgeries, minimal invasive surgeries. But now you are a country which has grown the fastest in terms of adoption of robotic surgeries. So you have more than 100 robots in the country as of now, and you have more than 2,000, 3,000 surgeries are happening robotically now. And so this is quite a good improvement in terms of our surgical, and that's basically a technology. So now you have Da Vinci generation 4 available in the country, which is basically you're able to precisely take out the tumors, extract it to the extent you want, and then you have other technologies to help surgeons. Those are probes basically to see whether there is you have taken the complete cancer out or if there is something left or not. So it has gone to that level of precision, in submillimeters, so that the radiation becomes effective, so that the other chemotherapies become effective. Because it is also about, see, modern technologies are also about optimizing the treatment, while you using these technologies. So so that has happened, and that is basically, it has also brought all the doctors who are involved in caring for the patients together, because now it is possible. Earlier it was, the technology itself was not evolved to that extent where it could bring the disjointed care, which was largely manual efforts. Now people can connect through technology, and they know that a surgeon knows that what exactly is the role of a radiation now. After surgery or pre-surgery, now you have multi disciplinary tumor boards as well. So that is first take. So I thank Dr. Prabhat. Now I come to the technologies. So now in terms of technology, so you have a technology which are pretty advanced in terms of detection of cancer, which can actually predict. So now you've a technology available in detection in terms of genes. You can do the next generation sequencing also. You know how precisely NGS, what kind of tumor it is, because the two people are actually have the same cancer, but the response is completely different. So that actually allows you to tailor the treatment. So what treatment is going to be effective there, and that's where you prolong life or you improve survivorship. It's not only survival today, it is also the survivorship. You also look at that. So that is largely in that. So you have circulating tumor cells which are basically blood cells before the cancer happens. You come to know about it in 6 months if you have a high risk group. You have a saliva based test available. Dr. Manjari was talking, in a session before that. So these are detecting technologies that you have. The only thing that we lack is that we lack the patient, encourage the patient to come to these technologies are available or use these technologies at a mass level, so that you can actually you can detect it early and then can treat it early. Because I can understand Dr. Prabhat's pain, the kind of cases he will get at a late advance, where it challenges surgical skills of a doctor, because you just don't know how to deal with that. It's such a large tumor, and it's so complex. Because Indian patients, remember, so the Indian patients are also comorbid patients to a large extent. So it's very difficult, for a surgeon or for a doctor to treat, whether it's a radiation oncologist or the surgical oncologist or the medical oncologist. So you need to optimize that. So these are detecting technologies which are very promising, and a lot of them are available now. It's just that the people, the message has to go to the people that these are available options. These are not traditional, technologies to detect. Second thing is the treatment technologies. So now if you look at the treatment technologies, surgical, you have already, you've gone to the robotic, which the adoption is, pretty faster, and it is becoming cost effective. Earlier, the insurance would not cover those, and patients had to shell out more money for that. Now, all insurance accept that, which is another challenger for another session, right? But it has reduced cost. So earlier, the cost was pretty prohibitive for a patient. Now it has come down to a little higher than the laparoscopic cost. So that is being accepted now, apart from the clinical outcomes. So the cost is also getting, because the more technology get accepted or diffused, the wider the scale, then you can have a profit. The hospitals also can have a profit, and everybody can benefit. Whosoever is fit is benefit from these technologies. That is one. Now when I talk about treatment technologies, let me tell you that the world is very promising of these technologies. So in medical oncology, you have 138 new molecules which are there in advanced research for various kinds of cancers. So that's just the pharmaceutical one, and these 138 are very promising molecules. Number one. Then you have cellular therapies. So if you look at today's newspaper, only Apollo has launched CAR T cell. So it was there for last 2 years. It's been an experiment and all those things in India. Although Shiba started it 5-6 years back, Gustavo Rusi started it 5 years back, MKCCC started it 5-6 years back. So now it is available within just a 5 years of time span with Indian database. So cellular therapies are available, right, for in medical oncology itself. Then so you have a lot of personalization, you have a lot of customization, you have a lot of tumor by tumor, patient by patient immunotherapies available for breast cancers, for lung cancers, etc. So modern technology has allowed doctors to actually tailor and study their patients, apart from doing NGS, genomics, and gene therapies, etc., etc. So that's a very promising field. You look at the promising field of radiation, where a lot of work has happened now. So you have a country where you have a proton available, apart from traditional radiation, which takes care of 95% of the patients. And in those, tradition, it's no more the earlier radiation, which was just giving them beam. It is a very, very precise and adaptive radiation that you are doing today. And there are a lot of modalities which got developed, whether you talk about brain, so you have SRS, you have SBRTs, right? You have other modalities available, your VMAT, etc., and all that. So, so you have radiation oncologist who can do that, and then they can also filter their own patients for a newer technology, which is proton available. Very soon you will see that, so proton was a difficult game, and for a country like India, where the costs of treating patients is very high, but India has been able to reduce the cost of proton. So you look at a world treats proton almost in a crores of rupees. In India, you can get the treatment at a 30 lakh rupees here. So that has reduced, although from an Indian perspective still it's very high, but it is covered by all insurance now. They've accepted it, right? So tomorrow, down the line, 5 years, you will have a carbon coming in, right? Which is again scarcely available in the 3 places of the world. It is available, but it is now also going to get mainstreamed. So in terms of modalities of the treatment, in terms of new technologies of the treatment, and the same technology actually getting refined, you have a better targeting of tumors, you have a better treatment, you have better medical outcomes, you have a prolonged survivorship or survival for that matter. And in terms of a detection, also you look at now the role of AI is coming in. So you have a PAT CT, you have a fusion of MR, then you have low dose CTs, then you have X-rays. What is happening is now, so earlier we would think that PACS is just a normal PACS, but it's not a normal PACS. Now the entire AI is sitting on those PACS, studying imagings, the structure of the images, the depth, etc., and giving a birth to a new department altogether, which is radiomics, where the AI is studying almost 1 million images in just a year and understanding that this is the tumor. So diagnosis itself is going to become cheaper in next 5 years because the AI can study that this is what the cancer is and can help a doctor, in terms of taking care of the patient, in terms of actually, focusing a lot on the treatment, in terms of, compared to the diagnosis where he's spending a time. And early detection is becoming an issue for a country like ours. So the more this technology comes, the more the adoption. See, remember, as we are, the cancer in a country like India, another aspect of India is which we do not focus on. It's a pretty young country, and cancer is now becoming younger. So it's happening in young patients. So our ability to harness technology is pretty high compared to other nations. Our adoption is very high. So next 5 to 7 years are pretty exciting because all these technologies are going to become mainstream technologies for our doctors because our medical talent is humongous. It's accepted across the globe so far as Indian doctors, and their ability to take risk and mainstream these technologies is very high. So AI field is going to be very exciting on imaging. So medical oncology is going to be very exciting with the newer molecules coming in, with the cellular therapies, more targeting, precising immunotherapies coming in, and then radiation is very exciting now. So it's not simple radiation; it's a very, very tailored and customized tumor-specific radiation that we are giving, and there are forms of different radiations are available. And then you have a theranostics. Now more hospitals are interested into radiopharmaceuticals, where you have a iodine-based, you have a lutetium, right? These are getting, and the regulatory framework is also getting ready to help so far as the government is concerned, it's now pretty agile in terms of approval, in terms of inspection, and in terms of approving these newer therapies. So it's pretty exciting to see.
Glad there is quick transformation, and as we mentioned, that the transformation through technology is going to be there sooner. Now I come to Dr. Aftab. Given these technologies that are soon becoming mainstream as we talk, what is the confidence it gives? In the earlier session, there was a speaker who mentioned about that there are patients who talk, कितना टाइम लगेगा कंप्लीट होने में, सर्जरी हो जाने में, और कब तक हम लोग ठीक हो जाएंगे. Cancer is a disease which needs a longer attention and treatment and monitoring. What is the confidence these technology give you as a senior consultant radiation oncologist?
So thank you, Sudheer. I think most of the points have been touched by Dr. Raina and Mr. Varun. I'm being radiation oncologist. I would like to put few things, just would like to highlight or add few things. So basically, whole world is developing. More technology, new technology, better technology is coming every day somewhere in the world. And we have moved from bullock cart to jets, from 2G to 5G plus. Okay. And from radical surgery, like Halsted used to do radical mastectomy, to BCS, we have moved. And same is true for diagnosis and treatment in most of the oncology related department. So coming first to diagnosis. So as Dr. Varun said, AI has made a way in medicine also. It's been used in many other industries for decades, especially like in aviation. If you talk, Airbus, They even 15-20 years back, they used to tell fly-by-wire technology. So, but that is becoming now becoming true for medicine, and especially AI has made a certain big impact in radiology. So certainly you were talking about, I mean, timing. So now, I mean, most of the time these MRI, CTs can be done in much lesser time with more precision. Okay, so this is one. Second is like pathology. So these two are the basically very important for oncological treatment. So coming to pathology, so certainly we started 15-20 years back when I joined oncology. So we all started treating cancer, and reports used to take a lot of time to be processed and available to us. And we were treating most of the cancer in terms of size, numbers. So typically what we say TNM staging. So but especially after 2005, when IRESA came into market, that was perhaps the one of the best targeted agent which came for CA lung for EGFR mutated cases we identified. So we realized that all lung cancers are not same, and same is true for many other cancers. Like today, if you talk of breast, they are not. Stage 1 TNBC is worse than stage 3 hormone positive cancers. So these tests, even these basics tests like ERPR were not available, which is now available, as Dr. Raina said, in tier 3, tier 4 cities. These are simple tests. So technology has come to smaller cities and everybody is using it. And other parts of, I mean, coming to other parts of the pathology, so all molecular NGS, Dr. Varun, Mr. Varun has said about NGS. So these are not now available. Like me and Dr. Raina practice in Ranchi. We are able to do these tests in our cities, molecular testing, genetic testing. So these has so overall diagnostic test or treatment, these are become more affordable and accessible to more population, and this is simply has happened because of advancements in technology. And one example is this: we as four of us sitting in different part of the country, maybe I don't know where you are based, but due to technology it has become so simple, we are talking to each other, discussing few things. So this is how technology has evolved over the years, especially when we were child and when we were children rather. So we can't, I mean, dream of like this. We had to go for even simple ticket reservation of train. You had to go to I mean, counter, railway counter, and spend hours, and sometimes you have to look at for agents also. So technology has played very important role in whole world, in our lives, including medicine and especially oncology. And this is how things are being done in oncology. Coming to the treatment part, as Mr. Varun said, especially radiation. Now, with latest treatment, many of the survivorship he talked about. So patients are surviving for years, decades after treatment. And when they live longer, they tend to have second malignancies, second cancer. We see in our OPD very frequently. Patient has lived for 7 years, 8 years post-treatment, and now they are coming back with other malignancy. Maybe we treated tongue, now they are coming with some buccal mucosa. We treated breast, one patient came very recently. So that is how things have changed. And not only treatment, quality of life has improved a lot with these technologies. Earlier, we were removing whole breast. Any female, you will ask whether you would like to sacrifice your breast, whole breast. They're not happy. But at that point of time, that was the standard of care, you can say, and that was offered, and they accepted, even if they were not ready from inside. But today, technology has become available to smaller cities. at that point of time, then BCS came, and BCS required most of the cases radiotherapy. Now radiotherapy is available here. Every smaller cities, radiotherapy is there. And coming to radiotherapy, how I mean it has evolved. I mean, I started my career with Cobalt machine almost 20 years back, 2004. But now I'm having a machine which can treat, I mean, with very high precision, image guidance, and real time gating. We are doing like so, decreasing the toxicity, increasing the effectiveness or of the treatment, thereby overall increasing the therapeutic ratio of the patient. We're treating the same cancer, but now therapeutic ratio is much higher, so better I mean treatment outcomes, less toxicity, and better quality of life. So this has happened. Now, earlier, when we were treating patient in radiation especially, we were doing like 10 years back adaptive radiotherapy. After 5-10 scan, we used to see how tumor has regressed. And after that, we again rescan, replan. That was time consuming. Now, with AI and this thing, a new technology, we are on the table, patient is lying for next fraction of treatment, we are able to treat or make new plan within 5 to 10 minutes. Patient don't need to undergo again planning and CT scan, everything. That is done on the machine. Ethos is there, a machine from Varian. So that is possible now. So less time consuming, more patient friendly, and we are able to do it with the patient comfort. So this is what we got. Coming to re-irradiation, all this thing, those have also become much more easier for patients who are having recurrent disease. Coming to like oligometastatic disease, earlier even a single mets was coming to brain 3 centimeter, we were stamping that case. Look, you have got brain mets 20 gray 5 fraction, 30 gray 10 fraction to brain, and that's it. Now you are facing the death. So this is how it, but now with technology, we are giving very, very focused radiation in form of stereotactic radiation to patients. And those oligometastatic case, which were 10-15 years back, we considered incurable. Now those cases are curable. So this is how technology has helped doctors and patients. So with this, I would like to finish. I think that's enough. I think I've told.
Thank you, Dr. Aftab, for sharing us the kind how the technology is slowly becoming mainstream, and it is also reducing the pain of patients and making the procedures of doctor very comfortable and easy for them to deal with treating the patients. Now, before we come to end of this session, uh, I wanted to ask all of you, irrespective of the organization you belong to, how soon the technology is going to be become mainstream. At the same time, now it is costlier. How, when is it going to be? I mean to say, very economical to the citizens, and they don't have that fear of financial burden, entire economy getting disturbed. Uh, how soon it is going to happen, and what would be the role of our government organization, and how they can help the citizens. We can start with Dr. Prabhat. Can you please unmute?
Yes, you all, you all know, we all know that technology comes with a cost. There is always a limitation of cost for a newer technology. Whenever a new drug comes, it's very costly. Same with we all have. Aftab will be agree that earlier when we used to in the college area, college time, transdermal was very difficult to prescribe. So hardly few of the ladies were able to take transdermal for HER2 positive breast cancer. But nowadays it has included in Ayushman Bharat. Almost all the patients having a HER2 positively they are receiving. There's a change in the technology. It has decreased. The cost has decreased. Similarly, NGS it is costly. Still, immunohistochemistry is costly for our part of the country where we are practicing. But with the proper planning, government has to assess that whatever the technology is coming, if it is really helpful in the patient treatment planning and overall, there is a strong data to implement in the treatment planning, it has to be included in Ayushman Bharat scheme and other government scheme. All the insurance companies must clear it so that it will be available to the masses, not only the selected group of the people, particularly in diagnosis. Similarly, PET scan, it has to be also included in Ayushman Bharat, the government scheme, and it has to be, cost has to be come down. The PET scan is cost about 25,000 rupees. But with the use of government policy has that if the cost only can come if there is a cyclotron is available in every state, and only then it will control the cost of the PET scan. And we know that PET scan, if it is be more and more easily available, it will help in the patient treatment planning. So government has planning has to think something one more beyond that the controlling the price. They have the controlling of the technology also. That's putting a cyclotron is not an easy job. The government had to take the pain so that the most more PET scan can be installed in the state, other colleges, hospital and medical colleges, and more people get benefited. Similarly, in the cost of the drug, immunotherapy, they are coming in the big way in the treatment, medical oncology treatment, but still cost very high. So you can't control the cost because there is just a research molecule which has come within the next last 2, 3, 4 years. But with the proper government planning and proper tie-up with the research body, it can be included in the scheme. And because they have a last portion, last majority of the people will able to afford it, the volume will be much higher. So they will be compensated according by the volume. So planning should be that these all technology be in next few years, by 4 5 years will be available in the majority of the city and majority of the people and the cancer patient in our part of the country. Similarly, robotic surgery. There are Mr. Varun has involved, mentioned about the Da Vinci. There are other robotics are also one from the India is also coming CRM, and that cost will be lesser. So by few years, I think in our life we are changing a lot of changes in the technology part, which will be implemented as early as 5 to 6 years.
Thank you, Dr. Prabhat. There is certainly intervention, and there needs to be a political will to prioritize the technology, the cost of the technology. At the same time, as you mentioned, there is a model rethinking of insurance is needed. And your take, a brief take on tailoring coverages for evolving cancer therapies, Varun.
Yes, definitely. Yes,
Okay.
this is.
Yeah.
Go ahead, Doc. You're going?
No,
Anything you would like to add, Dr. Prabhat?
No, tailoring made this is cancer is now it's going to be not one disease like lung cancer, breast cancer, one cancer for everyone. It has to be a tailor-made treatment for each and every individual. There are person which the same disease live longer. There are few which you can't survive for 6 months also. So all the treatment by the genetic study, by NGS, by molecular study of the tumor biology, we can tailor-made the treatment, and this will be the best thing which we can by technology we can offer to the patients.
Thank you, Dr.
So I just would like to add here, Sudheer, what doctor has said is absolutely true. When you have a patient who's been detected with the cancer and is being treated, at the same time, government also has to work, and it is not only the government; it is the entire society. The government has to drive this. Is that we have to control the incidences? Actually, we have to reduce. So the lifestyle is one. So you have entire gut, colon, etc. And the lifestyle is one. The pollution is two. You have to work on that. And so if these two are taken care of, actually you can reduce. It's a competing priority. You can reduce these incidences. At the same time, you can actually allocate that money when the incidence goes down to the personalization treatment of patients, and you mainstream NGS, etc., and all genomic studies and the circulating tumor cells, etc., and all these diagnoses. Select a population, make insurance, but make it part of insurance coverage. So if you are actually in Ayushman Bharat, make sure that the OPDs or at least the investigation is covered, so that more people can be detected, and then you can actually bringing these technologies faster in the use, rather than letting them be limited only to few, 5% of the population or 10% of the
Yeah.
population. Yeah.
Yes. Thank you, Mr. Varun. Over to you, Dr. Aftab, your take.
Yeah, basically what Dr. Raina said, I entirely agree, and Mr. Varun also said the same thing more or less. So these 2 points I agree, but I see technology use in especially oncology. I see at a larger perspective. So you have to see the total economics of thing. If you are diagnosing a case properly and treating appropriately, you will be spending much less money. If you see in totality, if you see, you will be spending much less money. For example, if you do an EGFR test in a lung and say that patient comes out to be EGFR mutated, patient is, I mean, won't be having unnecessary toxicities, unnecessary financial toxicities, so many things. So ultimately you will be having more response rate, better quality of life, more efficacy of treatment. So overall, if you see, you will be saving money. Like PET scan, Dr. Raina said, it should be available and accessible to almost all oncological patient wherever data or evidence is there.
Yeah.
So, as you said, Dr. Rana, this PET scan is available. I have met one doctor from UP. They are able to do PET scan in Ayushman, but I don't know what is every state. Perhaps they have not accepted it. That's
Yes,
why
yes,
it's not happening here. But it is available in Ayushman. So that has to be seen. And if you do PET scan, and if it's cheaper, even if it's not available in a other government scheme, if you do it and stage is properly and then treat adequately, then I think you'll be having overall cost of treatment, if you see, or cost of overall outcome, it will be less. So this is my point, I think.
Thank you very much, Dr. Aftab, thank you, Dr. Prabhat, and Mr. Varun for sharing those insights. It much needed, and the kind of attention that needs towards the fear that cancer treatment or diagnosis involves is immense. So we need to burst that fear and hope. We bring in some policy intervention also. IndiGlobal Media Network works with the government, and maybe we can bridge that gap between the healthcare leaders and experts like you and the government, and we constantly bring in that awareness and mainstream these technologies so that it is in reach of almost all the citizens of a country. With this, we come to end of this session. As a courtesy, it's our as a token of appreciation and gratitude towards our speakers who bring out their deep insights and uh, and the kind of experience, rich experience in the talk. We present a certificate. First, I would like to present Dr. Prabhat Raina for bringing in the kind of expertise who has joined us from the state of Jharkhand, and our heartfelt gratitude to you, sir.
Thank you. Thank you, Varun.
Thank you, sir.
Thank you so much.
Next up is Mr. Varun. Thank you once again for it's
thank
our
you.
heartfelt gratitude. Please accept and for your insights and expertise.
Thank you, thank you, sir.
And also Dr. Aftab Ansari from HCG Hospital. Thank you, sir, for taking part, and we would come forward to collaborate, and soon we are doing something in Jharkhand as well.
Thank you, Sudheer.
Thank you. Thank you
Thank
very
you
much,
so much.
everyone.
Thank you, everyone. My panelists, thank you.
Thank you, doc.
And just to inform you all, we are doing something which is focused on Northeast in association with the Ministry of Development of Northeastern Region, Government of India. We would be hosting a second Cancer Care Symposium where most of the audience and institutions are from 8 Northeastern states, including healthcare departments, educational institutions, to share best practices, innovations, and also explore the opportunities of collaborations.
Best of luck.
Thank you. Thank you all.
Thank you, Dave.